Hello, welcome to MyKneeReplacementRecovery.com. Today I'd like to talk about my experience with cortisone shots prior to TKR surgery. When I first injured my knee about 40 years ago playing basketball, it swelled up. I went to the doctor, he drained it, and the first thing he did was give me a cortisone shot. In those days there was no imaging, so he just kind of guessed at the best place to insert the cortisone. It seemed to work for me, but it was temporary relief. It didn't do anything to heal the knee. I did discover later on that I had torn my meniscus and it was necessary to have surgery, so they discontinued the cortisone and did the surgery. After the surgery, I didn't have any more cortisone shots for about 20 years until it became uncomfortable, especially when I was doing activity. At that time, I would get a cortisone shot once or twice a year. It was a pretty heavy dose. The needle was inserted on the opposite side of my knee, the lateral side, even though most of the pain was here on the inside of my knee. Those shots, again, lasted about 4 to 6 months, and I would go maybe twice a year and get those shots. As the pain in my knee increased considerably, and I knew that I had less cartilage and there was just bone on bone, then I visited an orthopedic surgeon because I was considering having total knee replacement. At that time, they did have imaging, and he let me watch on a screen as he inserted the needle into the side of my knee capsule, and he explained at that time he was going to give me a smaller dose that might last 2 to 3 months at the most. And if I was considering total knee replacement surgery, it would not be wise to give a full dose because it can affect your immune system when you're having the surgery. And because of that, I had a smaller dose, and I did have surgery about 4 months later without any complications. Cortisone can relieve your pain. It's not going to eliminate your pain. And if you need surgery, that's what's going to eliminate the pain, and that's what happened in my case. Thank you for listening. Take a look at my blog, MyKneeReplacementRecovery.com.